Hi, I'm Richie Scafidi, and this is the video assignment for Theories and Procedures. Here we have a patient who's a 70-year-old female following a recent surgery and is now bedridden. We're going to apply intermittent compression to her lower leg to help prevent deep vein thrombosis. Some other benefits of intermittent compression can include edema control, treatment of venous stasis ulcers, residual limb shaping after an amputation, and control hypertrophic scarring. So before I apply the treatment, I'm going to check for contraindications and precautions. Contraindications of intermittent compression include congestive heart failure, pulmonary edema, a recent DVT, obstructive lymph nodes or venous return, local skin infection, hypoproteinemia, acute trauma or fractures, and arterial revascularization. Precautions for intermittent compression are impaired sensation or mentation, uncontrolled hypertension, cancer, stroke, or superficial peripheral nerves in the area. So once I've cleared her for contraindications and precautions, I'm going to begin setting up the treatment. I'm going to first pull up the patient's legging and remove her sock. I'll make sure that the area is clear and there's no jewelry in the area. I will then apply a compression garment underneath the actual sleeve for the intermittent compression and make sure there's no wrinkles in the compression garment. Now I can apply the actual sleeve for the intermittent compression unit. For this treatment, the patient is in a supine position with the leg of the treatment slightly elevated. So I will put a bolster underneath to elevate the leg. I will then set up the parameters for the treatment on the compression unit. The parameters for deep vein thrombosis are 75 seconds of compression and 25 seconds of non-compression at 60 millimeters of mercury for a 3-hour treatment. Once I set the parameters on the device, I will tell the patient that if there's any discomfort or she needs to notify me in any way to please do so. Following the treatment, I will remove all the compression sleeves of the unit and the compression garment, and re-inspect the area for any abnormalities. Expected outcomes of the treatment in the short term is to not find any thrombosis, and in long term is to continually prevent the deep vein thrombosis. Thank you.